Welcome back. We're discussing water fluoridation. Is it safe? Is it effective? Or, as Dr. Dickson just pointed out, is it ethical? And again, joining me is Dr. Dickson to have this discussion. Just before we went to commercial break, we were discussing a book by Edward Bernays, Propaganda. And you said he was a student under Sigmund Freud. Uh, please explain how he became relevant or a factor in the fluoridation movement.
So after his great successes convincing women and doctors that smoking was safe for pregnancies in particular, he was hired by the fluoridation industry to whitewash fluoride and also by the fertilizer industry because what we have in our city waters, for 95% of North America at least, is hydrofluorosilicic acid. HFSA, it's quite a mouthful. It's scrubbed out of the fertilizer industry stacks because it's not allowed in the air, it's not allowed in the ground, it's not allowed in any of our waters, lakes, rivers, oceans, by strict law because it's so toxic. So they scrub it out of the fertilizer stacks, out of the waste stacks, and then they ship it back to Toronto, your city, and put it in your city water just after they've cleaned the water with 4 or 5 stages of processes.
Mhm.
They inject this uncleaned hydrofluorosilicic acid into your water and call it fluoride. And it comes along with arsenic and lead and mercury and strontium and bromium and traces of a lot of other nasty things that you don't want bioaccumulating in your body over time.
My goodness. Okay, so that's so in Canada, when did it become normal to start adding it, or which was the first municipality, and where did it go on from there?
Because in the late 1940s, they did studies with Kingston and I can't recall the other city, parallel cities, and they jerry-rigged and cherry-picked those studies, and they didn't even complete the studies. And then they said, "Yep, fluoride's safe and effective and wonderful. Let's run it all across North America." And
Okay, and is that
that
documented that they were jerry-rigged and handpicked?
Oh yeah, there's definitely some people have torn apart those studies and show how poor they're just very poor quality studies,
Right, okay.
and they just picked what they wanted out of them. And so Edward Bernays, after his campaign was successful to fluoridate a lot of America, he said it was one of the easiest things he'd ever done, one of the easiest things he'd ever been hired to do, was to convince doctors and dentists that fluoride was safe and effective for children.
Which I find interesting, because my dentist, I'm not going to say who it is, but I was always told that you shouldn't drink the fluoride when you go for treatment. You should apply it topically. Now, topically,
Yeah,
there are some benefits, but no, you don't drink fluoride. And then I, of
no.
course, would counter, then why is it in our drinking water? And he just raised his eyebrows and said, "Oh." So,
Well,
like, I mean, fluoride topically applied is okay.
topically is okay. We don't touch that one. The CDC, the Center for Disease Control in the states themselves, admitted after they called water fluoridation one of the top 10 medical miracles of the 20th century, a couple of years later, they came out and quietly said, well, folks, the effect is only topical, really. So you
Mm.
shouldn't, they didn't say you shouldn't be ingested. It just said the effect is only topical. So yes, it's your choice. Toothpaste, rinses, gels, foams, anything you want to use with fluoride, that's your choice, but
Mm.
don't swallow it. It
Yeah,
says
and
that on my business card, fluoride, don't swallow it.
and
So
again, I mean, I think this is a health matter, but I don't agree with putting it in the water system because that's a universal, accessible thing. You have children who are infant, like 1 year olds drinking water, and then you have men who are 6'5" drinking water, and there's the same amount of fluoride in both, but both those bodies could absorb it differently, and I think that is something to be concerned with.
absolutely. The
It's just
toxic
a
dose for
concern.
babies,
Right, like
toxic dose
when
for
you do
babies
vitamin
is
D
very
dose,
small.
yeah, when you do vitamin D
Yeah,
dose, it's a smaller one in the dropper than it is for the adult,
that,
and, I can meter
and
that as a parent, but how does one meter water fluoridation if I have no control over it?
exactly. And the fluoridationists, the pro-fluoridationists will never talk to us about that. How do you control dosage? And that's how I got into the ethics question originally. It's not ethical to mass medicate without control of dose or dosage. The pro-fluoridationists will never address that. They brought the concentration down from 1.2 parts per million to 1 part per million to zero point 0.8 parts per million. Now it's zero point 0.7 parts per million. But the
Why? Why did
concentration
the
has
concent
so little to do
why did the concentration go down over years?
because we've been pounding away at them with all the science showing neurotoxicity, and they want to go, well, smaller concentration. But again, Tanya, if you drink 10 glasses of fluoridated water and I drink one, you're getting 10 times the dose. And you're probably half my weight, so you're getting 20 times the dosage, which is amount of med per kilogram.
And if
your
you're in a
body weight.
warmer climate or you're more physically active and you consume a lot of water or you're on the carnivore diet or something, yeah, that's pretty intense.
So we're not going to put Prozac in. We're not going to put aspirin in the city water. We're not going to put any of the statins like Lipitor in there because they can't control the dose. They cannot control the
Right.
dose of fluoride, and fluoride is a medicine because it's used to treat caries.